From the News Channel 5 Network, this is OpenLine.
Good evening, everybody. Thanks so much for joining us tonight. I'm Cuthbert Langley here for OpenLine. We are talking about children and mental health. It's obviously a conversation that's been had a lot across the country in recent years. I'm joined tonight with two specialists. We're really excited to have these folks with us tonight. Dr. Karen Ray and Lisa Eggebien these are kind of experts on children and mental health. So thank you guys for joining us tonight. We really appreciate it.
Thank you for asking us.
Yeah, absolutely. So before we get started, before callers start calling us, can you kind of run through what your specialties are and how you assist folks with these issues?
So I'm a physician. I was initially a pediatrician. I retrained 10 years in child and adolescent psychiatry and general adult psychiatry. My most recent position for the last decade or so has been as the chief medical officer, the chief psychiatrist at CenterStone, which is a large community mental health center across Middle Tennessee.
Okay, great. And what about you? Kind of run through what your roles have been and kind of what your expertise is in.
Sure. So I also work with CenterStone with Karen. My background is I'm a licensed clinical social worker. So kind of my specialty and area of practice is working with children and adolescents, specifically around traumatic experiences that they might have had growing up or developmentally. Okay.
And for people watching, kind of run through what CenterStone is and kind of what resources you have for folks who may need some of those resources.
Well, we are a very large mental health center. We're actually multi-state, but if we look at Tennessee, we're largely in Middle Tennessee. We have 18 clinics scattered around through Middle Tennessee, staffed for psychiatry, psychotherapy, case management, and then we have a large crisis service, which Lisa has been involved in. And we have a number of grant-funded programs and a broad array of services for all ages.
Okay, right. Absolutely. And for you, excuse me, kind of what kind of purpose do you have, and kind of where do you fit into the CenterStone mission?
Right. So historically, I was an outpatient therapist providing psychotherapy for children and adolescents. So one of many outpatient therapists. One of the other services that we provide is school-based therapy as well as community-based practices. So we have case managers that will go out into the community and meet with children and adolescents and their families.
Okay. And mental health has been obviously talked about so much, really within the last, I would say, really 5 years, 10 years. What are some of the bigger issues, kind of the most common mental health issues you guys see among children and adolescents?
Well, we see a number of disorders that are roughly considered to be developmental disorders, and these would present in the first few years of life. And the most common one that we treat is actually attention deficit hyperactivity in that group of disorders. We also see youngsters with behavior disorders such as oppositional defiant disorder and conduct disorder. We see a significant number of youngsters with autism spectrum disorder. We see tic disorders such as Tourette's. So we see a number of the childhood disorders, but then we see some of the more adult disorders that have an onset in childhood, such as depression or anxiety or substance abuse.
And obviously with younger children, it may be tougher to navigate if a child is having something going on, if there is something wrong necessarily. Like, how do you kind of navigate those waters and figuring that out as a parent?
Well, I think we generally hope that children are accomplishing their developmental goals, what a 3-year-old might do, what a 4-year-old might normally do. For youngsters who are school age, you know, it would be appropriate for them to be going to school, to have appropriate social relationships, to manage in the classroom, to make sort of average or better grades. When we begin to see children who are crying, who are having temper tantrums, who are not eating normally, not sleeping normally, those are some of the telltale signs.
Okay. And you guys are in schools as well, you were talking about. You said you had a school program. What are some of the issues you guys are running into in schools these days?
I think primarily it's when the child begins to have a behavior problem, because we know that in the school setting, behaviors or those tantrums that Karen was talking about doesn't necessarily bode well for the teacher or the classroom setting. And so that's oftentimes when we see a referral come across.
Absolutely. Well, you guys see the number on the bottom of our screen, 737+. We would love to hear whatever questions you guys have for us. We're joined right now with Melinda, who's on line 1. Good evening, Melinda. How are you doing?
Hi, thanks for taking my call.
Absolutely. What's your question?
Well, I didn't see whether or not one of the guests was a psychiatrist or not, because I came in up like 5 minutes after you started. But what I wanted them to speak to is the difficulty that, say, children, once they grow up, say they've been traumatized as a child, and something happens to the brain chemistry, or, some kind of, or maybe they were just hit on the head several times, and so now they have a personality disorder. Can somebody speak to how hard it is, even as an adult, because sometimes those things never heal, and, they just never heal.
Absolutely. But, yeah, it's, I guess, the difficulty of these issues coming into adulthood. Which one of you guys can touch on that a little bit?
Well, I will start, and then Lisa can finish. I think when you talk about head injuries, that really depends on the severity of the injury. If those are mild injuries, children have remarkable ability to improve, much greater than adults might have. In terms of trauma, and I'll let Lisa talk more with this, we certainly hope that we can treat it and get improvement. Unfortunately, untreated trauma, the symptoms often do persist into adulthood. So.
Absolutely.
Yeah.
What we know is that adverse childhood experiences or traumatic experiences that a child might have as they're developing, if not treated earlier, the better, can oftentimes translate into some sort of mental illness, and oftentimes medical issues as well.
Right. And how do you treat those? I mean, there's such a varied way of treatment, I'm sure.
What we hope to do is involve all of the services that we have available. So in terms of community mental health, the idea behind that is that if we work together in terms of community outreach, in terms of psychotherapy, in terms of psychiatric services, usually we're able to have the symptoms remit. As Karen was talking about, children are very resilient and are able to move past those traumatic experiences if they get the right help. Oftentimes, we don't necessarily get the right help when we might need it.
Absolutely. And what role do you think social media is playing in a lot of the cases you guys are seeing or experiences you're running into? Because it seems like everywhere, every day, there's some new social media app out there for children, and people are interacting more, but you're seeing increased cases of bullying, you're seeing increased cases of self-confidence issues. What role does that play?
Well, I think the bullying really has been exacerbated by social media. I also think that actually our suicide situation and our mass shootings are somewhat exacerbated by the coverage and the sort of contagiousness of these events.
Absolutely. That's a point a lot of us in the media world have been talking about, is when we're covering, the perpetrators behind all of this, are we glorifying what they did? Are we giving them more attention? And that's such a tough line to tell, but you can say, I guess, that there is some sort of cause and effect there, I guess.
I think also, though, with the addition of social media, it also has helped to somewhat destigmatize mental health issues or mental illness, which is a positive side effect. We never want to see these tragedies happen, but we would definitely want to have a place and a time to be able to speak on mental illness and the ability to get better if you seek help.
Absolutely. Well, we're going to take a quick break. We're going to be right back, but if you have any questions during the commercial break, give us a call, 737+, that's 7587. We'll be right back after this.